You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, please go ahead and introduce today's guest.
Hi, I'm Ivan Zach, and I'm happy to introduce you to Dr. David Bessler. He's a colleague of mine and almost a client at some point. David built an amazing organization. He is a founder and CEO of the VEG. So it's VEG, but properly pronounced the VEG. And what I know, it's the veggies are people that work there. It's Veterinary Emergency Group. He has a degree, veterinary degree from the University of Pennsylvania. And some fun facts about him: he served in Israeli Army Special Forces. His dad owned a toy store where he learned a ton about customer service, as well as he worked as a waiter as a kid, where he also learned a lot about customer service. He's passionate about teaching children about animals and nature, and he appears on Sesame Street as Dr. Dave to educate children about pet care. I did not know that about you, David.
That is super cool.
That is so cool. So welcome to the show. And I will disclose why you were almost the client. I was trying to sell you a smartphone. You went with Instinct. But I'm not gonna hold that to you. And we actually had Caleb here on the show, and it was a lot of fun. Welcome. Thank you for joining us. I know you're a busy guy. Thank you for joining.
Thanks for having me, guys.
And Dave, I got a question to start off. How old were you when you were a waiter as a child? And what country was this?
Crazy. I was 14 years old when you could actually work as a waiter in the United States, I guess, at 14. And I did that until I was late teens, maybe even early 20s.
That's amazing. I started off in the restaurant industry as well at 15. I unfortunately had to tell a white lie to get the job because you had to be 16 at the time. And the guy that hired me knew that I lied and hired me anyways. And I worked there. It was my first job for 6 years. Ivan, when you're in Antigonish next time, I'm going to take you there for a steak. You'll love it.
Wow.
I might have been illegal to work at 14. I don't know what the statute of limitations is on that kind of thing, but like I might have been working illegally at 14.
Well, I think in Canada, you are also legal to drink from 14. Is that right, Shawn?
That's right. Yeah, exactly. That's
That was Ukraine. I forgot. That's where I'm from. So David, super unique thing you're doing. So there's tons of people that are building, I don't want to call it consolidation because I don't think it's a consolidation. You're building a de novo. I know that you acquired a couple hospitals, but you're building something where I burned out at. So I burned out being an emergency veterinarian. So I want to know what inspired you, what are the specifics, and how did you decide to build a large group? You're 18 now? Hospitals?
Just opened our 17th on Wednesday.
17th. That's amazing. So what inspired you and how did you get there?
So first, thanks for differentiating between consolidators or roll-ups and the brand building, which is what we're doing. We mostly, for the most part, I think we only bought 4 of our 17 hospitals. The rest we built, and we plan on building from here out. If your question was like what inspired me, I can't say that I had any grand vision very early on. I was always an emergency doctor and was really passionate about emergency. I was a total emergency nerd, and I was always very passionate about helping the people that came along with their pets that came to see me on emergency, making a great experience for them. And I guess I did that for a while. I was a very early employee. I like to say I was the first employee of Blue Pearl, what eventually became Blue Pearl. And in the end, they'd fly me around to look at their businesses that they bought that had emergency services in them. Then I decided to strike out on my own and have my own emergency business, and bought a 25-year-old nights, weekends, and holidays locally built, shareholder-owned emergency practice that was failing, lost money for the past 3 years before that. And my wife and I just ran that together. She's an optometrist, not a veterinarian at all. And we ran that, and I guess I would say the industry had been waiting for somebody who cared a lot about emergency to come and just reinvent the entire thing from the ground up. From there, I don't think I had originally any grand vision of creating an empire, but we really just put one foot in front of the other. We made one hospital that was great. We built another one that was amazing. And then we realized that we could do this all over the United States, if not all over the world. And that's kind of how it happened.
Wow. You didn't plan to build an empire, but you did. So that's amazing.
On my way. Right now it's a village.
Exactly. So my question is around what I mentioned about my experience. So I love emergency. This is all I wanted to do. And then I jumped both feet in, and probably because I was doing also relief work between the emergencies, this is how I burned out. But I have a deep understanding and passion towards people that do emergency because it's hard. I always say that emergency veterinarian is way harder than the regular practitioner because everybody who sees you doesn't want to see you. They've been sitting at home having a beer, your dog is puking, they have to rush to the hospital, pay the money. So you're converting that experience into something amazing, but you also convert your veggies, as you call them, into amazing experience. So what is that specific about your garden for your veggies that you do so they love their job?
Yeah, it's a great question. During the interview process, people often ask us, they say, this sounds too good to be true. What's the catch? Because everything that they hear about the company as emergency professionals, what they hear about it is great. And I tell them, the catch is a giant one, and it's right in front of your face. And it's that emergency is super hard. Emergency is incredibly hard. And so we don't need to make it any harder. We need to actually make it easier in every way for you to do the amazing emergency work that you do. And because we're focused exclusively on emergency, we're the only company in the United States to focus exclusively on veterinary emergency. The entire company bends towards that mission of both for pet owners, who we call customers, helping people and their pets when they need it most is our mission. And then for our veggies, just making an amazing place for emergency professionals to work. And because all we do is emergency, we're able to do that.
David, that's so interesting. And so I remember speaking with a number of the people that work on your team and them explaining the difference between what you've built and what is out there that everybody else would experience. And there's a few things that I remember from those conversations, but how about you paint a picture for our listeners with some words? So if I come in to a veg hospital compared to another veterinary emergency hospital, what am I going to notice? What's different?
Thanks for asking that. It's a passion of mine, is making the experience for our customers really different, really helpful. So number one, it starts actually with a phone call. Most people, or many people, before they go to the vet, they call. They're at home, they're having an emergency with their pet. And so they just call, whether they call their veterinarian or they call a local specialty hospital, and they speak with a receptionist, and the receptionist tries to answer their question or just tells them to come in. When you call VEG, every medical question is answered by a doctor. So if you ask, is this a nipple or a tick on my dog? Even that will end up speaking with a veterinarian, and they will right away start helping address your concerns. So it starts at the phone call, and then you walk in, just like when you walk into a human medical facility. The first thing you see anywhere else is, a clipboard. Fill this out. Give us your insurance information. Wait here. When you walk into a veg, you actually don't stop. You're holding your pet. You don't stop walking. You walk directly into the treatment area. You don't fill out a clipboard. You don't answer any questions or anything like that. You walk right into the back. We call it the back, not the treatment area, because once you allow everybody into the back, there's no problem calling it the back. We have a back, we have a front, we have sides. It's called a back. And so we walk everybody to the back, and then right away, within moments of walking in, you see a doctor, a veterinary nurse, an assistant. The receptionist is kind of trailing behind you. And they right away start addressing your concern. We triage, if you will, as a group. So there's zero waiting time. You walk in, you see a doctor right away. That's the next thing that you'll notice. The other really revolutionary thing is that you stay with your pet. And so if we decide we're going to run some blood work, do some diagnostics, normally in normal, I guess, the traditional emergency setting, people would then take your pet away from you into the back and leave you in the lobby or in an exam room. You're already in the back. You stay there with your pet. We draw blood, put in catheters, do ultrasounds, whatever we need while the pet owner is still there. The next thing you'll notice is for treatments as well. Started with a catheter. If we need to set you up on IV fluids, do a laceration repair, do a pericardiocentesis or an abdominocentesis, the pet owner is there by their pet's side the entire time. The only time they're separated is if we have to take x-rays. They're not allowed in there while we take x-rays, but they'll help us set their pets up with sandbags, etc. Everything, every second that they can be with their pets, we try to keep them with their pets. We've had people mask up and scrub in and stand in the surgery suite when we're doing a resection and anastomosis on their dogs. We just don't separate people. People can, if they want, leave, but we don't separate them.
Wow. And so the first thing that comes to mind is that big shitty word that we all hate now is COVID. So how have things changed, or have they changed because of COVID with that experience?
Yeah. So If you're known as the company that keeps people and their pet together, coronavirus can really be a stake in the heart. However, the approach stayed the same, trying to break down barriers and remove all the weird things that time has put in place in an emergency experience that causes a separation. And so our people's approach was the same. So on day one, we told them, I really don't have to tell you, I have to protect you. So you just need to separate people and their pets during coronavirus. And our people didn't accept that. And so they did this really amazing, innovative thing where they said, if we can't bring people to the back, we're going to bring the back to people. And so our lobbies have big glass windows out to the parking lot. They moved their entire treatment area into the lobby. And so now you just, hand your dog off across the front door. And then there's an exam table there right across that glass window. And we just continue to treat them. And we actually don't need any video conferencing software because we just use a phone because the people are right on the other side of the glass.
That amazing tool called the telephone.
Yeah. Heard of it?
Yeah. That's amazing. That's so cool.
Yep. So I'm going to switch gears to the business side. So we work with the consolidators in my new gig. And the hardest part, what I find, is that people are merging these different cultures during acquisition. So they're buying these hospitals, completely different teams, completely different processes, completely different software. And then they're calling it one organization and they're trying to optimize and then say we consolidated the practices. And that's where the challenge comes in. So I can see that being so specific and targeted in one sort of niche, that may give you an opportunity and advantage over the groups of hospitals. Let's put you in the same group, the groups of hospitals where you can articulate and define what you want to do because you're building. Are you finding that as a part of the business plan that you can optimize the back end a little easier than those that consolidate existing cultures?
Absolutely. Everything from, I'm sure you guys do a lot about software, so I'm sure you'll ask me about software, but everything from software to just the builds of our hospital. I like to brag about the fact that if a specialty business or a general practice business or an everything business bought us, they wouldn't know what to do with our hospitals. Our hospitals are built backwards. There's no way to get from the lobby into an exam room. You have to go through the back in order to go to an exam room. They're just built backwards. They wouldn't be able to use them. And we purpose build our hospitals to conform to that specific emergency focus. Our people, a nice thing is, and I worked in specialty hospitals my whole life, is you're trying to cram a bunch of different services that have their own cadences, their own personality types, their own workflows, trying to cram them all into one workspace. The surgery service doesn't get along with internal medicine, doesn't get along with emergency, doesn't get along with critical care. For us, everybody does the same thing. Everybody works day shifts. Everybody works night shifts. Everybody works weekend shifts. We all do just emergency. And so everybody just gets along like that. Our focus, we have these things we call our spikes, which are our non-negotiables. And the first one on there is all we do is emergency. I call that the mother spike. Everything else flows from there, just from our focus.
That's incredible. So there's also what I've seen in the organizations that thought of one sort of business unit and multiplied. The big component that I had to go through, let's say in SmartFlow, and right now we're building in VIS and everything else. What I learned is that to create the glue that connects people in the organization, you have to have strong core values and the mission behind it. So can you talk about that? When did you have to define that? Was that the first hospital you built and you're like, I'll start with mission, vision, and core values? Or was that something you arrived to and you implemented? And if you, I don't want to put you on the spot, but if you remember some of your core values, if you can share those.
Yeah, if there are any veggies that are listening to this, I think they're probably chuckling to themselves because they think that this was a planned question.
Really?
I love it.
I'm an evangelist for discussion of mission, vision, and core values. I think I talk about it 1,000 times a day, and my people are probably sick of hearing it, but I think they love it. So our mission, I mentioned before, helping people and their pets when they need it most, is just what defines emergency. I think to a 5-year-old, they would understand on Sesame Street. I could explain that to the kids on Sesame Street, helping people and their pets when they need it most. We have it written on our walls. Literally, if you go to any one of our hospitals, it's written on raised letters that are glued to the walls in big. So if you're ever wondering, because I said emergency is hard, and if it's ever really hard at night, you can always look up and understand why you're doing this. And our vision is kind of longer. I won't go through it in its entirety, but it addresses all of the stakeholders from VEG as a whole to be the world's brand of veterinary emergency provider, to our referring veterinarians to be true partners for them, customers to be like the place where they want to go if they're having an emergency with their pet, and to our veggies, where we ask them to brag about their jobs and we hope for their friends to be jealous of the job that they have. And all those are in our vision statement. It's what we aim for, our dream state. Our core values came later. I didn't understand the purpose of core values until I read a great article in Harvard Business Review that talks about the difference between core values and aspirational values. And I think what he calls pay to play values, which are basically, if your values are don't steal, don't rob, be good, like that's ridiculous. That's actually maybe a Western civilization value. You shouldn't have to tell your people not to steal, cheat, and lie. So that doesn't make sense. Aspirational values, great one are like, if you say my value is efficiency, then you'd say, oh, so your people are really efficient. And then I would say, actually, they're super slow and inefficient, but we really want them to be efficient. That would be an aspirational value. Your values, your core values, should describe who you are already. They should underlie the best decisions you've ever made and the best parts about your company. And so very recently discovered, I don't know if you guys are familiar with Animal Arts. It's we use them as our architectural firm. They're wonderful. They're based out of Boulder, Colorado.
I heard of them, yeah.
Cool people. They had a conference called the Crystal Ball, and I lectured there recently on our core values, on discovering our core values. They should be discovered, not created. And going through that process, I discovered our core values are togetherness, openness, and meaningful moments. I'll start backwards. The meaningful moments happen in emergency. Emergency is just an amazing thing. The openness is we just open it up for everybody to be able to see and appreciate all the amazingness that happens in that meaningful emergency moment. And then you have to actually bring everybody together so that they can all participate in it. So we welcome everybody from customers to all of our veggies, everybody there together at the same time. Those underlie, I guess, the best parts about VEG and the best decisions we've ever made. Those are our ore values.
That's awesome.
Yeah, really incredible. My favorite core value of my startup Talking To is our no asshole core value. I had the fortunate or unfortunate experience, I think, like all of us have, to work with assholes in the past, and it's like our number one showstopper. If you exhibit any of those symptoms, we get rid of you right away. And so it's kind of interesting, and there's a lot there. I do want to turn to technology for a minute. Me and Ivan are both technology startup founders. And you've built this incredible business around incredible people. But there's also probably an incredible technology part. Is there any kind of must-haves that are on your list that really help you guys run at the rate you do and do the things that you do?
And don't say instinct.
Or say it.
I love Calvin. It's instinct. You can say it.
The no asshole policy. I think that you have to put that in place. Hired Ivan. That wasn't obvious.
That's so good. That's so good.
I think the most essential piece of technology that we have is something called Workplace. Workplace is the internal Facebook. It's Facebook's Facebook. So Facebook designed this internal social media platform for their own company. And it looks very much like Instagram and Facebook had a baby. It kind of looks like that. It's we just tried it out, and it took over. Facebook's, I don't know their mission by heart, but it's connecting people and building community. And they really live up to that mission. They've done that for us. If you look through our internal workplace, you just see pages and pages of our really proud veggies posting pictures of their first surgery that they did, or this amazing patient that we just discharged or saved its life, or just the wacky dance that they made up at 3:00 in the morning and on TikTok, or new hires, new babies. We have veggie sprouts. Every time a veggie is born, they get all sorts of veg baby swag. They post pictures of the veggie sprouts. So I think that's probably the most essential technology that we have now. It really glues all of our people together. But in a more clinical sense, which is I think probably what you meant when we started, is we use Vetspire as our practice management software. We find that it really allows us to customize the UI for our veggies, great customization for our customer experience. It's really easy to use. It's very focused. It doesn't have to. We don't have big needs out of a PIMS because, again, our focus allows us to just have one type of way to run through software. It doesn't have to make sense for the neurologist and the ophthalmologist and the general practice and boarding and grooming and reminders. We don't need all that stuff. We don't even need a schedule because we don't have appointments. So we use Vetspire for that. I think you had Sam again on the program. He was great. And then last but not least for you, Ivan, we use Instinct. Instinct is it basically runs the scheduling of our patient care, would be the best way for me to describe it. I'm sure Caleb Frankel would tell you that it does a lot more than that, which it does for us, but we rely on that to make sure that all of our patients get their treatments on time, that all those things are recorded. And he's got really nice tools on there in terms of the integration of plums, and he's got a lot of patient safety features in there, which is really helpful for us too. I'll say we still use even though Instinct has features that support this, we still use in most of our hospitals the plain old whiteboard to manage our outpatient care, just because we have not found a solution that handles that perfectly.
See, if you use SmartFlow, then
I was going to say, I'm so glad we're out of time. Ivan doesn't have a chance.
It's not my thing anymore. God bless IDEX, and they can use it and sell it to you. So I'm not here for that. Do you know we had Caleb here, actually, David? We had Caleb on the show. It was pretty cool.
Oh, that's great. That must have been, did you guys have like boxing gloves on? Or
no, listen, it was one of my favorite episodes because I just actually really great. The bear.
And the bear didn't wake up, and Caleb was very graceful. It was awesome. It was really nice. So you should, if you have time, listen to it. It was great. I love having you here.
I haven't gotten that far down. I use Spotify to listen to my thing. I guess it's like further down on there. But right after we're done, I'll listen to it.
Yeah, lots of gold to come in the list. Yeah. So David, listen, this was a total pleasure. A really fun conversation. I can't wait to visit one of your hospitals someday and just check it out. It sounds super cool. And I remember talking with VJ, your IT guy, and him explaining this to me. And I was like, oh, wow, this is really kind of neat. So we like to kind of wrap up every episode in the same way. So we got a couple questions for you. First is, something that you've read, something that you've watched, something that's inspired you to kind of get where you're at in your career. And it sounds like you're having a lot of fun. So I'm looking forward to the recommendation. Go ahead.
Yeah. So I have two, if that's okay. I love reading, and so I'll just make them quick. So just finished Steve Jobs by Walter Isaacson, which is the authorized biography of Steve Jobs.
Right.
And I learned a ton about what not to do as an entrepreneur and as a leader, but also a lot of what you should do if you're passionate about your product. If you want to make something amazing that the world has not seen before, there's a lot to learn from in that book. The next book may be a little bit more useful for people is Nonviolent Communication by Marshall Rosenberg. Marshall Rosenberg, there's actually a website. I think it's called the Center for Nonviolent Communication. It's just a beautifully written book. And a beautiful system for communicating with people in a way that is just pleasant and peaceful, non-confrontational, non-violent. And so I definitely encourage you to read through that. Those are, I guess, two things top of mind.
That's awesome. And the last question that we usually ask is there someone in our industry that you think we should invite to this podcast?
Yes. And again, I have two.
Let's take two.
So the first is Dr. Hilal Dogan, who's the founder of Veterinary Confessionals Project. And she is the only veterinarian that I know of that's certified in trauma, emotional trauma management. She's really plugged into the world of compassion fatigue and emotional trauma, especially as it relates to veterinary medicine and veterinary emergency medicine. She's an emergency veterinarian at a great emergency vet company. But besides that, she founded the Veterinary Confessionals Project, which is at all the conferences, and it's online, I think, at veterinaryconfessionalsproject.com. So she's one person to speak with. And then the other is Dr. Danny McVetti. It's actually, I'll give you a secret, it's actually pronounced McVetti, but she loves the fact that it's that people call it McVetti. She's the founder of Lap of Love. I don't think you've had her on the program, but I would say she's done for end-of-life care and for euthanasia what we have done for emergency, and that nobody's ever imagined it as its own thing that needs to be reimagined from the ground up to make it the best experience for everybody involved. And she's really done that. She's a wonderful person, wonderful entrepreneur. She does really amazing work with end-of-life hospice care, euthanasia. I would definitely, it's at home. It's an at-home euthanasia and hospice business. So definitely encourage you to speak with her.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.